Shannon Miller, a gold-winning former Olympic gymnast and the 10th most decorated Olympian ever, was diagnosed with ovarian cancer in 2010 at the age of 33. She almost didn't attend her regular health exam after becoming a new mother to her son. Miller underwent surgery to remove the baseball-sized tumor from her ovary and then went through 9 tough weeks of chemotherapy to keep the cancer away. Luckily for Shannon, her cancer was stage 2, a lower stage, and the cancer hadn't spread to the rest of her body. Unfortunately, many people don't discover they have cancer until it's too late and the cancer is spread like a fire. Cancer can affect anyone in any part of the body, but there are ways to help prevent yourself from these horrible diseases. According to the Centers for Disease Control and Prevention, cancer is a term used for diseases in which abnormal cells divide without control and they can invade other tissues. Throughout the blood and lymph systems, cancer cells can maneuver their way into other areas of the body. Cancer begins in cells, and it starts when one or more cells start changing. Normally, every human has an equal amount of cells due to the body producing signals telling cells when to grow and divide. When these signals are missing or faulty, the cells divide uncontrollably and they form lumps or masses called tumors. The digestive, nervous, and circulatory systems are usually harmed by tumors, and they release hormones that affect body function. If a tumor stays in one place and doesn't grow, that is called a benign tumor. This is considered the better of the 2 types of tumors. The other tumor type is malignant. This type forms when a cancerous cell moves around the body through the blood or lymphatic systems. Malignant tumors are also formed when a cell grows, divides, and makes new blood vessels to feed itself. Once a tumor reaches this point and spreads all over the body, that is called metastasizing. Once the tumor reaches this point, it is also very hard to treat. Cancer is not just one single disease. Cancer is a group of diseases. There are over 200 different types of cancers, says Medical News Today. Each type of cancer is categorized by the cell type it affects. Cancer can affect anywhere of the body, like the brain, breast, cervix, kidney, liver, lungs, pancreas, or prostate, but cancer is divided into 5 main categories. The first category is carcinomas. They develop in the skin and tissues that line internal organs. They usually form a solid tumor, and this is the most common type of cancer too. The second category is sarcomas. These develop in the bone, cartilage, fat, muscle, and other connective tissues. The next category is leukemia. This develops in the blood and bone marrow. The fourth category is lymphomas, which develop in the lymphatic system, which is a group of blood vessels and glands that help fight off infection. The last main category is the central nervous system cancers. These develop in the brain and spinal cord. Depending on what type of cancer and what area of the body the cancer affects also depends on what symptoms the patient will experience. According to the Mayo Clinic, a couple common symptoms that are related to cancer include fever, lumps, fatigue, skin changes, weight gain or loss, difficulty breathing, trouble swallowing, and unexplained bleeding or bruising. If someone is experiencing these symptoms, it is because as the cancer grows, it pushes on blood vessels, organs, and nerves, and then causes the symptoms I listed earlier. Cancer is complex in the fact that there are not only hundreds of types, a multitude of symptoms, but there are also different stages of the complexity of the cancer. Stage 0, the best stage, is when the cancer has stayed where it started and it hasn't grown to other areas of the body. Stage 1 cancer is relatively small and is only spread a small amount. Stage 2 and 3 is when the tumor size increases and it spreads more rapidly to other tissues. Stage 4, the worst stage, is when the cancer has spread all over the body. This is sometimes called advanced cancer. If someone is experiencing these symptoms and they are diagnosed with cancer, they should take action right away. Although there are many different approaches into helping treat cancer, the 3 main treatments are surgery, radiotherapy, and chemotherapy. Surgery physically removes the cancer from the body. This works for many types of cancer, but for some it does not. The single time surgery isn't the best option is when the cancer is spread all over the body and it cannot be safely removed without harming very important organs in the patient's body. During radiotherapy, cancer cells are damaged so they can't keep forming. Radiotherapy is performed similarly like getting an X-ray. This is usually a pain-free treatment depending on what area of the body is getting treatment. Sometimes patients use a combination of surgery and radiotherapy to help treat tumors that have grown in the same place. The last main treatment is chemotherapy. Chemotherapy uses medicines to attack cancer cells and to delay their growth. Chemo can be given through an IV or the patient can swallow a pill. Chemotherapy is used when the cancer is spread all over the body. Like surgery and radiotherapy, chemotherapy can also be used in a combination with one of the other two. Depending on what stage and what type of cancer the patient is going through also depends on what treatment would be best for them to go through. Every person is also very different, so treatments vary from person to person as well. When people are diagnosed with cancer, they often ask, "Why me and what did I do wrong?" Sometimes cancer runs in people's genes and they have a family history in developing cancer. Specific ethnic groups also possess a more serious risk at developing certain kinds of cancer. Smoking tobacco and drinking alcohol increase your risk of developing cancer. Even inhaling secondhand smoke increases your risk. If you are out in the sun for long periods of time without protection, one can develop skin cancer from these things. If you work in an environment that produces a lot of vapors and dust and chemicals that make contact with your skin, you can also develop cancer from these things. Although preventing yourself from cancer entirely is nearly impossible, there are many things you can do to lessen your chance of getting cancer. As a responsible adult, both males and females should get health exams. Some of these exams include colonoscopies, mammograms, and a Pap test. Receiving regular, up-to-date vaccines is also important in preventing cancer. Making healthy choices is also an important step. Eating lots of fruits and vegetables, staying active, maintaining a healthy weight, avoiding tobacco, and limiting your intake of alcohol all help in preventing the development of cancer. Hearing the word cancer never comes with happy feelings. Cancer is something that should not be taken lightly, and it's a disease no one wishes to be diagnosed with. If you are diagnosed with cancer, though, there are many ways to get help and receive treatment. With preventative actions, screenings, and vaccines, you are on the right track to living a happy, cancer-free life.